there, my name's Olivia, and today we will be covering the case study about Maria. So the skills or tools that I would use to establish rapport with this client would be active listening and empathy, which would allow me to validate her concerns about the cost, time, and confusion surrounding nutrition. Motivational interviewing would help me to explore her readiness for change. I could ask her questions such as, what worries you most about your health? Um, and I would listen and validate her answers. And then cultural humility. I would acknowledge her Latino heritage and her family traditions surrounding food. And then I would also use collaborative goal setting and frame the conversation as a partnership and as teamwork. And we would work together to establish realistic steps for her. And then some additional health information that I would like to gather would be things like sleep habits, because fatigue can cause um, sleep quality is closely linked to hypertension and um, glucose dysregulation. I'd also ask her about her stress levels because chronic stress can exacerbate her symptoms. Detailed dietary patterns, such as her portion sizes, emotional eating, and her family meal dynamics, even what time of day she's eating. Is she distracted when she's eating? Um, and then her medications, her supplement use. So, if she uses any over the counter supplements or even things like um, NSAIDs and Advil, GERD medication. I would also ask her about her mental health, such as anxiety and depression that can hinder her lifestyle changes, and then any other seemingly unrelated symptoms, such as skin tags and goiter of her thyroid, which can impact her metabolic health. And then her health status and risk assessment. So she has prediabetes. Her fasting glucose is 118 milligrams per deciliter, which the range for prediabetes is 100 to 125. Her A1C is pre-diabetic at 6.2%. And then hypertension, her blood pressure was elevated at 148 over 95. She is considered obese with a BMI of 31.7. Um, she drinks 2 drinks of alcohol per day, which exceeds moderate guidelines, and can increase her blood pressure and her glucose levels. And then she does have a family history of diabetes, so this also increases her um, risk, and it highlights a need for urgency and prevention. So, top priorities for the clinician, for my top priorities would be to reduce her blood pressure and insulin resistance with a diet that is lower in refined carbohydrates and sugars, such as lemonade and ice cream. And I would focus on increasing her fiber with vegetables and beans, legumes, and then I would lower her alcohol intake. I would help her aim for about less than or equal to 1 drink per day. And then movement, such as a 10-minute walk after dinner to help with mitigating her blood sugar response after a meal. And then Maria's likely priority would be an affordable, sustainable approach to diet and lifestyle changes that fit her family cultural context. Um, So, what would my response be to what should I eat and my thoughts surrounding the ketogenic diet? So I would empathize with her and validate her frustrations and confusion. I would let her know that I hear her frustrations and let her know that nutrition advice can feel overwhelming. I would address that the keto diet may lead to quick weight loss, but it's very restrictive and it's hard to maintain long term. Um, and for prediabetes, we want balanced meals to stabilize her blood sugar, meals that are high in fiber and protein. And then I would recommend small swaps and affordable veggies and proteins to not overwhelm or stress her out. And then I would help her to focus on progress and not perfection. So, the strategy for goal setting, some smart goals that we would set would be week one, replace one sugary drink with water daily, and week two, add a 10-minute walk 3 times a week. Um, the assessment guideline or timeline would be a 2 week follow up to check her adherence and adjust her goals as needed. And then we would check labs in 3 months to repeat her A1C, her fasting glucose, and lipid panel. Some of the barriers include cost, time, family preferences, and cultural food norms. But some opportunities include the use of her grocery job. She might get discounts on fresh produce. Family involvement. She could teach her kids to cook healthy meals and they could make it an enjoyable thing to do together. Community resources such as local parks and free fitness classes to help her get some exercise. And then we would look for some free or low cost educational resources and programs on diabetes management. Um, in order to assess her receptivity, I would be asking scaling questions such as on a scale of 1 to 10, how ready are you to cut back on wine? And then why this matters, it ensures that her goals that we're setting align with her readiness, and this prevents discouragement and overwhelm if she's not very ready at the moment. Um, and then the recommended labs and referrals, I would recommend a lipid panel to assess her cardiovascular disease risk. We would look at her liver enzymes for an alcohol use screening, and then I would refer her to a diabetes prevention program that is CDC recognized for support. Thank you for watching, and these are my references.